So welcome everyone to the Greene County Chamber of Commerce Watch and Learn series. For today's presentation, we're welcoming Terry Wiltrout, who's the Vice President of Operations for Washington Health System and the President of Washington Health Systems Greene. The topic for today's presentation is COVID, 1 year later. Thank you for joining us. We hope that you learned something during this Watch and Learn, and we hope in the future to return to at least hybrid or in-person lunch and learns moving forward. Stay tuned for more information on that, and that will come out to members as it is available. So at this time, I want to turn everything over to Terry. And Terry, welcome. The floor is yours.
All right. Thank you, Melody, for allowing me to take the time to give an update on everything that our health system has been doing around COVID, really over the past 14 months. So the data that I'm going to present, the things I'm going to talk about today are for Washington Hospital, Washington Health System Greene, and our Washington Physician Group. So we'll go ahead and get started. Some inpatient stats. Right now, our current COVID census, we have 6 inpatients that we're treating between Washington Hospital and Washington Health System Greene. Over the last 2 weeks, our ranges in inpatients ranged anywhere from 9 to 11. And our busiest time and our peak was in late November. At any given time, we could possibly have up to 57 inpatients between both hospitals that we were treating for COVID. Right now, we've had 1,019 total COVID admissions, 881 at Washington Hospital and 138 at Washington Health System Greene. During the pandemic, we had 90 deaths. 86 were at Washington and 4 were at Washington Health System Greene. Average COVID patient age, 69. And December was our busiest month for COVID-19 admissions. We had 233 COVID admissions during the month of December. 196 of those were at Washington Hospital and 37 were at Washington Health System Greene. You can see from the chart that these are our COVID positive inpatients. You can definitely see our peak. Started right around the end of October, peaked up during December, and then dropped dramatically there in February. But then we did have in April a spike again. That spike returned right around the 1st, 2nd, and 3rd week of April. As far as testing goes for COVID, we've had 2,849 positive COVID tests that came back. So this was some of the equipment here on the left of the screen is what we were using for testing both outpatient and inpatients. The BD Panther, BD Max, and the BD Veritor. We had set up testing sites in Greene County, Washington Health System Greene at the hospital there. Up in Washington County, we actually set up a trailer, and you can see that at the bottom of the screen. That was out by our wellness center, down by the Cameron Wellness Center, that trailer. We set up some respiratory clinics to treat outpatients that had COVID symptoms. We did not want those outpatients coming into our physician practices, coming into our hospitals that had symptoms. So we would take them to our respiratory clinics. We had one respiratory clinic set up at Neighbor Health Center, which is 95 Leonard in the building that you see on this slide. We also, one of our pediatric practices down at Cameron Wellness Center, we set that up for respiratory clinic. And then our family medicine down in Waynesburg, we had set up a location there. And, you know, we had to take these rooms, the treatment rooms, make negative pressure for them. We did the COVID testing there. We had a single entry and exit point that we had to put in place to be able to take a look at these folks to see if they truly had COVID. So between those 3 sites, we've seen over 700 patients with the symptoms. PPE, everybody talks about PPE, you know, lots of, our director, Dougie Rohr, he was so busy ordering gowns and gloves, N95 masks. The helmet that you see down here at the bottom is a standard helmet that we use. It's shown without the face shield on the front of it, but it's a Max Air helmet. It's basically what we used, our nurses used, our radiology department used. to be able to go in and treat COVID patients or possible COVID patients. But, you know, Doug had a heck of a time trying to locate any PPE, is the same way with any other healthcare facility during this pandemic that we dealt with. So we also set up a place to do therapeutic treatment. This was outpatient COVID patients that were positive patient treatment, that they did not need to come in the hospital for treatment. It was antibody infusion site. So what we did was we retrofitted a portion of our ambulatory care here at Washington Hospital. Again, we had to put in negative pressure, ICRA barriers, single point of entrance, single point of exit. We used our RNs to infuse antibodies. It took over an hour to infuse those antibodies, and then the patient would wait for another hour to make sure they had no reaction. And again, this was all outpatient procedure. And Diane Clark, who's the RN there in the photo, you can see she has a Max Air helmet on and the PPE on, and you can see the shield on the front of that Max Air helmet that she used. So we move on to vaccine clinics, vaccination clinics. We set up 3 mass vaccination clinics at Washington Health System. One of the first ones that we did is down here in the bottom left. That's Washington Health System Green. That was the old wellness center space. It was set and vacant. We converted that over to one of the vaccine clinics. Top left is Washington Crown Center. That was the old Ross department store. And we actually closed that. We finished doing vaccines there yesterday. And we are right now setting it up. We're relocating it here to Washington Hospital, the Stout Conference Center, and that'll reopen on June the 1st. That's where we first started vaccinating, was out here at Washington Hospital in the Stout Conference Center. And then the last place that we opened up was out at Peters Township Recreation Center. That's the photo on the top right and bottom right. We basically took half of one of their gyms and set that up as a vaccine clinic. So we had some challenges here trying to get the vaccine clinics up and running. We were kind of shocked back in November when the governor and the Department of Health announced that, hey, hospitals, you're going to be responsible for vaccinating everybody. That's not our norm. Usually vaccines are done in the physician practices or pharmacies. You know, we're used to treating patients, inpatients. So a team come together. We had 64 vaccinators trained between the 3 COVID-19 clinics. We had 133 volunteers, employees working at the clinics. So the total vaccines that we were given up there in the top right, that we have given total vaccines, actually it's a little bit more than that now. It's a little bit over 58,000 vaccines that we've given to Washington and Greene County and the community. If you look, our average, the total we've done so far in May, 7,335. Average per day was 489. In April, we did 15,991, average of 639 every day. Total March was 17,764, a little bit over 700 average every day. February was 9,879, average about 470. January was 4,506, average about 250. In December, when we started this all, we did 1,492 and averaged about 186 each day. You know, despite the pandemic, we still won some awards, still continue to focus on patient care, patient safety, and more. And some of those awards are listed here. Health grades for our new labor and delivery that we recently remodeled and renovated. We got that in 2020. Health grades for surgical excellence, that was just recently here in 2021. Leapfrog Award for hospital and patient safety was just here in the spring of 2021. Of course, Best of the Best, which they do here in Washington County, and also something similar to we do in Greene County, multiple categories that we won there. The Greene County Messenger, Best Hospital for Greene, Get to the Guidelines for Stroke, 10 years in a row, we won that award. And then the American College of Cardiology for, you know, that we're one of only 124 hospitals in the nation to receive that. And so those are just some of the awards that we received during the pandemic. Workforce recruitment. You know, right now, you see up here in the top right, we have 119 open positions in Washington Health System right now. And we have been challenged during the pandemic. And moving forward, I think we're going to continue to be challenged with recruiting. And these are jobs anywhere from entry level, housekeeping, to even recruiting physicians that have been very challenging. So we've come up over the past year with some kind of innovative approaches to staffing, and I just wanted to share a couple of those. We partnered with Workforce Development, Amy Gatz and her team, to come up with a couple programs here. One of them is a phlebotomy program where basically working with Workforce Development, we will recruit the phlebotomists, we will pay for them to get their training, we will pay for them while they're getting their training at Penn Commercial, and then we'll recruit them and bring them on board here at Washington Hospital or Washington Health System Green for phlebotomists. Similar program for medical assistants. Medical assistants is for our Washington physician group, struggling to get medical assistants. Again, we partnered with Workforce Development, Amy and her team, basically paying for them to go to Penn Commercial to get their education. Once they're done at Penn Commercial, then each participant signs a 2-year commitment to work in one of our physician practices. One of the other things that we had to do for nursing during the pandemic here was Washington Health System Green and Bridget Trump and her team came up with a creative solution for tuition repayment program for the nurses. So, you know, it's to help the local nurses pay off their student loans. You know, qualified candidates must provide proof of their outstanding student loans. You know, we'll pay up to $10,000 in return for a 2-year service contract with us. And nurses are qualified up to $300,000 in loan repayment for 6-year agreement at Washington Health System Green. They come on our nursing group. That's about all that I had. It's going to be quick and simple, but so we can open it up for questions. Melody, I don't know how you want to do that, but if anybody wants to come off mute, they're more than welcome, and I will answer any questions.
Terry, I'll start. I have a question for you.
All right.
Can you explain how the Max Air helmets work? I mean, they look like something out of Star Wars. I mean, they're really unique, or even like something that a gamer would wear. So explain how they work and how they keep the staff safe.
Yeah, so can you see my pointer here on the screen?
Yes.
Okay. So basically, if you see this cable, it plugs into a box that has a rechargeable battery on it. And when you turn that on, it basically, let me go to the next slide to show this. So basically, when you turn it on, there's a shield, and then it almost looks like, I hate to say this, cling wrap underneath that shield. And so when you turn it on, it's basically blowing air down across your face and out the bottom of that shield to keep anything from coming up underneath the shield and getting on your face. But that's how it works.
Interesting.
And so they have to be recharged, and there's little lights underneath. There's lights underneath the rim of this helmet that actually indicate, you know, if you need your filter changed, if your battery's getting low. Pretty neat technology.
Does anyone else have a question? They would like to unmute themselves, please feel free.
Come on, Lucas, you can ask a question. There's a number of members on this call that I see that really have been part of this workforce for Washington Health System and pulling this all together. Like I said, there's a number of things that we were tasked, that we were given. You know, probably one of the most frustrating things was the Department of Health would announce something before we were even notified that we had to change. And so then we were scrambling to make changes, whether it was a vaccine clinic or putting ICRA barriers up or making, you know, the rooms, every room that we had to treat patients in at these 2 hospitals, we had to convert each one of those rooms to negative pressures. And basically, we actually had to go out and buy a bunch of pieces of equipment that caused those rooms to be negative pressure. So a lot of work throughout the process.
We had several contractors that loaned us their air machines to help make that happen.
So basically what we were doing, we were using machines, construction machines that contractors use when they're doing construction to keep particles from floating out into our HVAC systems. We were using those in patient rooms.
They had built-in HEPA filters.
Yeah,
Ingenuity at its finest, right?
yeah.
Well, if anyone else does not have questions, we can go ahead and wrap this up. This is something that we are recording, as we mentioned in the beginning, and that's going to be available for us to distribute to those that couldn't make it today. And hopefully it will become housed on our website under a library of topics. And I know this is something that has been on everyone's mind for quite some time and has affected us as a global economy. So hopefully we're at the end of it. It seems like the numbers are going down as far as what you need to vaccinate, and moving forward, we hope that things will be back to somewhat of a new normal here very, very soon. And thank you to Washington Health Systems for being here to help our community here in Greene County get through this. And we appreciate all that you've done. And I know, you shared some behind the scenes things today that people maybe might not be aware of that transpired in your facility in order to keep us all safe. So thank you all very much for the tireless efforts of doing that. And we look forward to seeing more great things come out of Washington Health System. So Terry, thank you very much for being here, and those that joined, greatly appreciate it. And I'm sure we'll have Terry back at another point in the future.
All right. Thank you, Melody.
All right. Thank you guys. Have a great day.